Going to give you a mnemonics regarding Argyll, Robertson, Pupil. So, as we know, this is a common sign seen in neurosyphilis, where there is a light and accommodation dissociation, which basically means like when you shine a light to the eyes, it won't constrict. However, it constricts when you when you see a near object. That means accommodation reflex is present. However, the pupillary reflex is absent. So this is a hallmark to know about the Argyll Robertson pupil, which is called light near dissociation. But we know the concept, and we know like, okay, accommodation reflex is present, light reflex is not present. But again, it's always hard to remember which one is present, which one is not, especially in the exams, or whenever you have to remember this in a very short period of time. So there is a mnemonic to remember about that. So how I remember the mnemonics to make sure like, okay, I'm right, and though I understand the concept, but just to be fast sometimes, is uh, the short form of accommodation reflex present. The short form of Argyll Robertson pupil is ARP, which basically you can translate it as like accommodation reflex present. That way, the other reverse is absent. That means the pupillary reflex is absent. And if you read the same letter back from backward, like instead of reading ARP, if you read it like PRA, then you can know like pupillary reflex is absent. This is just an easy way to remember which one is present, which one is not present, and it will kind of help you in a short time. But however, it's always good to know why it happens. uh, this Argyll Robertson pupil is seen in neurosyphilis. However, it is also seen in some cases of diabetic neuropathy as well. It's very not so common in the developed countries. However, it is more common in the developing countries. So hopefully it will help, and I will share like some mnemonics that I use in my daily practice later as well. Thank you so much.